Thanks for staying with us here on 13 on your side at 8. I'm Emily Scarlett here with Chief Meteorologist Samantha Jackson and Dave Cackley on traffic. A lot to look forward to as we head into the weekend. Not there yet, but we're getting close. Of course, looking ahead to the opening of the Acrisure Amphitheater. A little Lionel Richie. Yeah, great first act
opener too.
It's
impressive that they got Lionel Richie to come out.
Yeah, I was impressed with that too. And a long list of performers that are sure to get those seats filled. And then on top of that, some nice weather to go along with that.
Yeah, we'll take the nice weather. I know we have extensive coverage tomorrow on the amphitheater. Even Dave, you're working tomorrow night.
I've got to pull double duty.
Whoa. I hope you're getting extra.
I'm getting it.
Little extra something for that.
We'll have to see. I got to talk to some people, to talk to some other people to get me a little more slack,
but we know that traffic is likely going to be a thing with that concert tomorrow night. So glad you'll be on that day.
Thankfully, I won't be contributing to the headache because the weather is going to be really nice tomorrow, both today and tomorrow, really. Starting things off with a look at our headlines across the area.
Now to some breaking news from overnight. An update on one victim from that after prom party shooting in Muskegon. The father of Jordan Williams says the driver of the car that hit his daughter has been found. Andre Williams posting that update last night. He says police were looking for a BMW and that he thinks that driver may have been also just trying to get away from the gunfire. Jordan, his daughter, is one of 6 victims. 4 other teens were shot. Another was also hit by a car. Jordan has several broken bones and has already undergone multiple surgeries. As this investigation continues into that shooting, Muskegon's mayor calling for support, accountability, and action. Mayor Ken Johnson says even though the shooting happened in Fruitport Township, many of the teens impacted are from Muskegon. He's urging the community to rally around young people while also calling on those responsible to turn themselves in.
It's a multifaceted issue. There's a lot of different factors and elements that go into violence. Youth violence, gun violence. What's critically important is that we love on our youth, that we support our youth, that we invest in our youth.
Fruitport Township Police and Michigan State Police are both investigating what happened Saturday night. So far, they've told us they think there were multiple gunmen. We haven't gotten any other information. We'll keep you posted as we learn more. A man accused of a deadly shooting at a Grand Rapids park is due back in court today. Fabian Leggett is scheduled for a preliminary hearing in connection with the death of 23-year-old Deshaun Guyton. Prosecutors say Guyton was shot and killed at McKay Jaycees Park last September. Leggett is facing murder and weapons charges and is also accused of lying to investigators. He's also already in jail on unrelated charges. $2,000 just went to the person who helped Kent County investigators track down a man accused of serious sex crimes. An anonymous tip to Silent Observer led to the arrest of Fernando Vasquez Pena last month. Pena is now facing a list of charges, including criminal sexual conduct and possession of child sex abuse materials. Officials releasing a statement reminding folks that anonymous tips help solve crimes. Tips can be submitted at the number at the bottom of your screen, online, or through the P3 Tips app. 2 Allegan County crashes are under investigation this morning. The first, killing a woman and leaving another with serious injuries. This happened around 5:45 last night at the intersection of 146th Avenue and 36th Street in Overijssel Township. Deputies say a woman in an SUV did not stop at an intersection and hit another woman in a pickup truck. The driver of that SUV was thrown from her truck and died on scene. The driver of the pickup was flown to a hospital. And quick reaction by an MDOT crew yesterday likely saved lives in a second Allegan County crash yesterday. The crew was working on the shoulder of US 131 near Wayland when a van veered from the left lane towards them. The workers jumped over the guardrail to avoid being hit. They have minor injuries. Troopers say this is another reminder to move over for cars with flashing lights and don't drive distracted. Meanwhile, drivers are still feeling pain at the pump this morning, but there could be some good news ahead. Gas Buddy says the average price for a gallon of gas in Grand Rapids has climbed to $4.98. Statewide and national averages are also continuing to rise. Patrick DeHaan with Gas Buddy says recent refinery problems helped push prices even higher recently, but that there are signs this spike could soon ease up some.
It looks like a lot of these issues are being addressed, though, at the wholesale level. There are signs that the wholesale price of gasoline is going to start falling, at least for now. But that still leaves us with the situation with the Strait of Hormuz being blocked.
DeHaan says drivers could see a 20 to 40 cent drop in the next couple of weeks. The deadly hantavirus outbreak linked to that South American cruise ship is now sparking a global health response, with cases spreading across multiple countries and dozens of people under monitoring here in the U.S. One patient in France is fighting for her life, while health officials in several states continue tracking possible exposures connected to that ship. ABC's Asan Singh has more.
This morning, a French woman infected with hantavirus is now in critical condition. Doctors say she is suffering from the most severe outcome of the virus, with life-threatening damage to her lungs and heart. The woman is now being treated with an artificial lung, as the World Health Organization says the outbreak has grown to 11 reported cases worldwide, including 3 deaths. Here in the United States, officials are currently monitoring 36 people across 10 states, including passengers who returned home early or shared flights with infected travelers. In Atlanta, 2 American passengers were taken to Emory University Hospital for evaluation, though health officials say the symptomatic passenger has tested negative for hantavirus. And in Omaha, 16 people remain under observation inside a biocontainment unit, including the only American to test positive for the virus so far.
I think we should not be surprised if there's additional cases. But now that we've identified all of these individuals, they've gone to their respective countries, and they're appropriately being monitored, we should expect cases to drop off after that.
Meanwhile, health officials in Illinois are investigating a possible new case that is unrelated to the cruise ship. The person reportedly experienced mild symptoms after coming into contact with the rodent droppings while cleaning. The more common way hantavirus is contracted. Experts stress that strain is different from the rarer Andes variant linked to the cruise ship outbreak, which can spread person to person in rare cases. And health officials say all of the people currently under observation here in the U.S. remain symptom-free this morning, but due to the virus's long incubation period, there could be emerging cases in the weeks ahead. Ashan Singh, ABC News, New York.
And now, to get a better understanding of the hantavirus, we've got Dr. Emily Abdallah with us live this morning. Thanks so much for joining us, Doctor.
Thank you for having me.
Yeah, excited to discuss this. Many people have questions following the news of the outbreak on that cruise ship. Should people be concerned about what's happening here?
The risk to the general public, as many others have said, is very, very low. This is an incredibly rare infection, and this is one particular type or aspect of a very rare infection. And from everything we know about the Andes virus species of hantavirus, past cases, as well as what we're seeing play out so far on the cruise ship, you aren't seeing a lot of transmission or any transmission beyond the cruise ship itself. It's really, from what we know of this infection in this aspect with the Andes virus species, it takes prolonged close contact in most cases for the infection to spread. And I think you can see that playing out in the fact that there were 140 some people on the cruise ship, and to date we only know about 11 cases, and all of the rest of the individuals are being very closely monitored. And so if you are sitting in Michigan, I think you can rest assured that your risk from this particular outbreak is very, very low. It is important to think about the risk to the hantavirus that we have in the United States, but that only comes from exposure to rodent droppings.
All right, really glad you clarified that. I want to talk more about that because this, of course, has many people afraid, thinking back to COVID and pandemic times. But we've heard from health professionals like you that this is different. It doesn't spread in the same way as COVID. You talked about that prolonged close contact. What exactly does that look like? Of course, with COVID, we had social distancing, we had our masks. What does it look like in order for that transmission to happen with hantavirus?
Right. So what we know about this, the hantavirus, the Andes virus species that's found in Chile and Argentina, and which is what has been implicated on this cruise ship outbreak. It's a rare infection. Again, only so many cases that we know about, but they've done extensive testing in those cases where there has been human to human spread. And what a lot of the reports tell us is that people who share bedrooms, even intimate partners, they're at higher risk than even household contacts. It can still happen within household contacts, but it's really that intimate or close, prolonged contact. Now, there was an outbreak in 2018, 2019 that affected about 30 some individuals in Argentina. And in that case, they were able to show that a person who was symptomatic went to a crowded indoor party, and that the people sitting nearest to that person over the 90 minutes or so that the symptomatic person was there, a couple of them did go on to develop hantavirus, but again, that's not the number of infected and the ease of spread that we see with things like COVID or influenza or even other respiratory viruses, certainly things like measles. And so generally what we know is that the closer the contact, the more prolonged the contact, the higher the risk, but it's not large numbers like we've gone through recently as a population with the COVID pandemic.
Well, say you are exposed and you do find yourself contracting hantavirus. You've said that this is extremely rare, but say that does happen. What are the symptoms you should be looking out for? How long does it take for those symptoms to start to show?
Right. So regardless of where you contract hantavirus in the Americas, so we're talking about the hantavirus species that we have in the United States, as well as the ones that we see in South America. If you are exposed, and this is usually through, remember, the exposure to the rodent droppings, often the first symptoms are not very specific. It's can look like any kind of viral illness. So people can have fevers, they may feel a little off or tired. We call that malaise. They may have headaches or joint pains, or they may have stomach upset, nausea, or vomiting. So that can look like a lot of different things. And there are many, many things that are much more common to cause those symptoms than hantavirus. It's after that first phase, which we call the viral prodrome, that people can then develop the severe respiratory symptoms that are indicative of the hantavirus pulmonary syndrome, which is the severe manifestations of hantavirus in the Americas, in the United States and in South America.
Well, we've just got a little bit of time left, Doctor. Really appreciate your time. I want us to end things with what should we be looking out for next? Of course, we know the Americans that were on that cruise ship have returned. Some of them are being monitored by choice because I understand it's not mandatory that they stay for that monitoring. What should we be looking out for next in terms of our concern or possible spread here in the U.S.?
Right. Well, what I think that this situation shows is just how critically important public health responses are. All of the individuals who have come back to the United States, as well as in other countries as well, from what I understand, they're having a lot of interviews with public health officials to figure out how close they were to any confirmed cases of hantavirus on the ship, who else they may have been around during any period of the ship's journey, how things went. And so they're trying to do, that's called contact tracing. So they're figuring out, is there anyone else who needs monitoring? The issue with hantavirus is that the incubation period is long, meaning the time from when a person can be exposed to the time they develop symptoms, up to 6 weeks. And so from what I understand, public health officials are calling the first day of that 6-week period the day they were able to get off of the ship and then be isolated from other passengers who might have started to be able to spread hantavirus. And so I think that the suggestion of isolation and the close monitoring and the interviews and really trying to understand that we have a full a full concept of who may be affected is essential, and that requires a lot of work and public health expertise. And so this that is really critical to the response, not just here, but in any country where one of the exposed passengers is returning to.
Dr. Emily Abdallah with the University of Michigan Medical School. Really appreciate your time this morning. Thank you.
Thanks for having me.
A simple tool that could make a life or death difference showing up in an unexpected place across Grand Rapids. A local nonprofit stocking old newspaper boxes with free naloxone, a drug that can reverse opioid overdoses. Placing them around the community will show you how this street level effort could help save lives. That's coming up.